Hello, good morning, everyone. How are you guys doing? We will be discussing today an interesting topic that we had worked on. So it is the impact of Hashimoto's thyroiditis on pregnancy outcomes. Now, it was myself and Mohammed Thokan that worked on this from RCSI. And to start off, essentially, Hashimoto's thyroiditis is an autoimmune thyroid disease characterized by the presence of thyroid autoantibodies. What we find is it's mainly just anti-thyroid peroxidases and anti-thyroid globulins. Now, whilst these are commonly associated with hypothyroidism, research does show that they can be, essentially associated or influencing the pregnancy outcomes, even in women who are just biochemically euthyroid. So essentially, the prevalence of TPO antibodies in pregnancy women ranges from around 5 to 14%, and TGAB can be found up to 18%. Given these figures, understanding their impact is essential. So we will be kind of covering this throughout the upcoming presentation. And just moving on to the objectives. Now, when we were kind of covering this, our main objectives was to evaluate the impact of Hashimoto's thyroiditis and essentially focusing on its autoantibodies and its key pregnancy outcomes, including the three main things: miscarriage, preterm birth, and postpartum thyroiditis. Now, just in terms of the methodology, what we ended up doing is kind of like a literature review and just kind of going and finding articles within different electronic databases such as PubMed and Google Scholar. And we use the key terms Hashimoto's thyroiditis, thyroid autoantibodies, pregnancy loss, preterm delivery, and postpartum thyroiditis. Now, this is all in the goal of tackling our objective. Now, starting off with miscarriage. Now, what we found was that multiple studies found that TPO antibodies positive women have nearly twice the risk of miscarriage compared to antibody negative women, which is a big thing. So one meta-analysis showed that there was an odds ratio of 2.36, and the risk was even higher for recurrent miscarriages, up to 85% greater. This risk persists even when thyroid function is normal, suggesting that even like the antibodies themselves is what's contributing to the pregnancy loss. So just leading on to preterm birth, essentially, we then analyzed the preterm birth and we noticed a similar trend. So essentially, it was just a large cohort study that showed 6.6% of TPO antibody positive women delivered preterm versus 4.9% of antibody negative women. It was just 4.9%. So we see a stark comparison between the 6.6 and 4.9. And other studies have showed that it was around 2 times higher odds in the antibody positive mothers. So this is essentially showing the same trend as what we suggested before. And even in euthyroid women, it was the same thing, suggesting that it's specifically the antibodies that are contributing to this. And just moving on to postpartum thyroiditis. So postpartum thyroiditis, is probably the most dramatic outcome that we noticed when we were covering this. It's around 30 to 50% of TPO antibodies positive women or mothers developing postpartum thyroid dysfunction, compared to 5% of those without antibodies. So that's a 5 to 10% increase, 5 to 10 fold increase in risk. And like the other outcomes, this can even occur in women who are euthyroid during pregnancy. It reinforces the fact that thyroid autoimmunity, not just overt hypothyroidism, is the underlying issue. So, like I said, this was the dramatic increase that we noticed. It was specifically the postpartum thyroiditis, which was a stark difference. So, just moving on, we had the clinical implications. Now, these findings have important clinical implications, and we've kind of divided it into around four different categories. Firstly is the early screening for thyroid autoantibodies, especially in women with a history of infertility, of miscarriages. They can help identify those at risk. Second is monitoring. So monitoring is key when it comes to this stuff. Uh, TPO antibodies positive mothers should have their thyroid function checked regularly throughout pregnancy and postpartum, even if they're euthyroid. Because as we discussed before, even if you are euthyroid, the issue at hand is the antibodies, autoantibodies. Now, third is management. Now, moving on to the management, it's going to include levothyroxine therapy. Now, some of the guidelines recommend treating women with subclinical hypothyroidism and TPO antibody positivity. Some experts even suggested treating euthyroid women with antibodies, even if they have a history of pregnancy loss. Okay, now just lastly, on a presentation for the clinical implications, we have the fact that we recommend postpartum follow-up at around maybe 6 weeks to 3 months. Now, educating the patients about the symptoms of postpartum thyroiditis is also crucial for timely intervention because essentially these are all categories that would help minimize the risk. And yeah, just moving on to the conclusion. Now, in conclusion, Hashimoto's thyroiditis, or more precisely, the presence of thyroid autoantibodies, like we said, is significantly associated with adverse pregnancy outcomes, including miscarriage, preterm birth, and postpartum thyroiditis. Now, these risks persist even in the absence of abnormal thyroid function. So, like we previously discussed, even if they're euthyroid, they can still have these risks, suggesting a direct effect of autoimmunity. Early detection, close monitoring, and timely management of thyroid autoimmunity can substantially improve maternal and fetal outcomes. Integrating these practices into routine prenatal care, especially for women at risk, is essential. Now, just moving on, we have the references. These kind of entailed all of the studies that we were talking about before and the relevant stats. Thank you guys so much. I hope you enjoyed and learned something important.